for the people at Manchester, especially at Manchester University, this is going to be very relevant. So we are now contacting the university administration about the possibility of using this particular app, largely created by these Imago 6 students from Imago Computer Science Club. And there's a possibility that we might try to combine this with the university policy of bi-weekly COVID testing. So please go ahead, Ingy.
Okay, so good morning, good afternoon, good evening, depending on where you are in the world. Thank you all for joining us today. So I'm Ingy, and today I'm going to be talking to you about LCT. A quick introduction before I get into the nitty-gritty details. I'm Ingy Abdel Halim. I'm a computer science student at the University of Manchester. A few months ago, I worked as part of the Imago student software team to help develop LCT alongside Michael Corning of the Soteria Institute and Professor Serhang Poon, a professor at the Alliance Manchester Business School, who's also the founder and trustee of EnduringNet. Today, I'm going to be talking to you about the specifics of LCT, and if anyone has any questions, please feel free to put them in the chat or ask at the very end of the presentation. So by now you might be wondering, what is LCT? LCT is a local COVID contact tracer that has that works on local areas but has global scope. Sorry. It works cross devices. It does not rely on GPS, and it is identityless. So a little bit more about each of these points. In terms of local area global scope, a COVID contact tracer is only effective if a large portion of the population use it. So because LCT is not limited by your geographic location, i.e. is not only for Manchester or only for the United Kingdom, it means that we can adapt it and use it in other places around the world. This also means that if you travel, you can continue to use LCT and you don't have to stop using your COVID contact tracer. So you can continue to keep yourself and those around you safe. In terms of it working cross devices, you can use it on any device that has search engine and wireless access. This means that if your device breaks, you can continue to use it on your iPad or your phone or your computer if one of them breaks. It also means that you can protect those around you who are not able to use devices. For example, elderly people who don't know how to use the internet or technology, you could keep track of their locations and past activity in order to keep them safe. In terms of us not using or relying on GPS, LCT logs activity based on longitude and latitude, and that is only once you log an activity. So we don't know where you are unless you tell us where you are. And this is a constant blocker for other people, people from using the currently available COVID contact tracers. In terms of the benefits of not relying on GPS, this means that LCT doesn't drain your battery life like other applications that rely on GPS. It also means that data privacy is not violated, and we don't know when you're going to your favorite coffee shop around the corner at 9 a.m. In terms of identityless, users are not identified based on their name. They are given a unique user ID that only LCT knows. The users and other users don't know this ID. And this means that for people who are scared of being identified based on their past activity or worried about other people knowing that they have reported having COVID, this is not possible because of the way that LCT works. Users are only identified based on a unique ID. So how does it actually work? We know that it doesn't rely on GPS and that we're able to support a large variety of locations such as those on the right. But specifically, LCT is an open source platform which was originally developed by Michael Corning. And the benefit of this is that we were able to develop two very different versions of LCT, one to suit Manchester and one to suit sisters. For the Manchester version, we were able to predefine the University of Manchester campus locations, for example, the Kilburn building or the chemistry building, and also the surrounding coffee shops. Whereas for the Sisters building, Sisters version, Sisters doesn't really have any large buildings with multiple rooms. So Michael Corning was able to develop his version to suit his local needs. Most importantly, if a building is not found on our list, you can simply use the gatherings option. And there's no need for official building registration, which means there is a lot of potential for protecting people in in locations that are not predefined. So now that I've told you what LCT is, I'll just go through a quick demo of a new user and of a user using the application. So let's say I'm a new user and I'm registering to use LCT. All I have to do is simply register a nickname. This is from 3 to 10 characters long. It does not have to be personally identifying. So for example, I've used lecturer as my nickname, and all I have to do is press absolutely. This nickname is, I only see this nickname, and it is simply shown at the top of my screen when I log in. So now that I've registered for my account, let's say a lecturer wants to create a tutorial group meeting at the local park. And this is going to be done through the gatherings tab at the bottom center of the screen. You simply type in the name of the tutorial group meeting. So in this case, it's X4 tutorial group meeting. Press enter in order to randomize it. Copy and paste this and send it to others that will be joining you at this gathering. And then once you've done that, you simply press on the light purple button, and then you'll be directed to the calendar view where you can simply drag and drop the event into the appropriate calendar location or calendar time slot. And then you simply accept that you want to, or confirm that you want to log it into your calendar. So now let's say I'm the student joining this tutorial group meeting or like group session at the local park. All I have to do is copy and paste the name that my lecturer sent me under join an existing gathering. Once again, press on select the time slot and simply drag and drop it into the appropriate time slot. So now let's say this lecturer has tested positive for COVID and they want to warn everyone. They simply go to the top right corner of the screen, press the warning button, and then they confirm that they want to warn others. And this is in order to prevent false warnings. Once they have confirmed and pressed I am sure, the student will immediately get 2 warnings. Like the student that was in the tutorial group meeting, they will get an orange warning for secondhand exposure and the red warning for firsthand exposure. Now let's say I'm another student, but I wasn't in this group meeting. I was in the same building as the lecturer, but we never shared the same room at the same time. I would simply get the orange warning because it's secondhand exposure. So now let's say another student, another day, another month, they want to log into a lecture. Let's say they're a computer science student. They would simply find Kilburn building, the computer science building, log into the lecture theater where they have their lecture. Once again, select the time slot and they're redirected to the calendar view where they simply drag and drop into the appropriate time slot. So now that I've shown you how to use LCT, why is it unique? Why should you use LCT in parallel with other COVID prevention strategies? Well, LCT gives real-time alerts. Like you saw before, when the lecturer pressed the warning button, the students immediately got both, either both the warnings or just one warning. It does not rely on GPS tracking, which has all the benefits I previously mentioned, but most importantly, your privacy is not compromised. We only keep data for 2 weeks. So travel history is deleted for 2 weeks, which is the estimated incubation period of COVID. And this means that we only keep data that will keep you safe. We don't keep any personally identifying data apart from that. It is identityless. So whether you want to use another device or you want to just make sure that nobody can track you based on your logged locations, this is not possible through LCT. It is most importantly for me, it's open source, which means that students can get firsthand experience creating technology that helps people around the world. But it also means that because of the adaptable nature of the LCT design, LCT can suit a large variety of communities with different needs and different requirements. So let's say someone in Portugal could want to implement it and they would be able to develop a local version of LCT. And like I previously mentioned, location is identified by longitude and latitude, which means that any location that has been mapped on Google Maps or any map source can be used and logged into the calendar, even if it's not a predefined space. And this means that LCT can be used globally. So what would this mean for the University of Manchester? It would be the first university to take such preventative action. It would be protecting students and staff. it would be making the change that would help keep community safe and most importantly, keeping Manchester and the students and staff safe. So these are some useful links. On the right are the current live versions of LCT. They are very different, so you might want to have a look at both of them. They are constantly in development, especially LCT Sisters. Michael Corning is constantly updating it, so it might not be active at all times. On the left are some useful links that you might want to use to learn more about LCT or the groups involved in developing it. And these slides will be available after the presentation, so you can click on these links whenever you want. So if anyone has any questions, let me just check the chat.
So now we open the question to the floor. Has anyone got any questions? Okay. No? So in fact, I think I forgotten, Ingy, whether you mentioned this project is open source.
Yep.
Yeah, so you can see that we set up these projects at Manchester University with the Computer Science Club. So everyone, including the original developers, Michael Cornings, are very happy to help another university set up the same system. I think it's kind of marginally much lesser effort now if you just want to clone the existing system at another university. And indeed, it can be used literally anywhere in the world. There's one thing that is very different from other applications in the sense that it is global. So if you have some gathering, some group, some family, or some relation, say, were together in Portugal, for example, if you continue to use the app when you are in Portugal, even when you return to the UK, the track and trace works the same way. It's kind of cross-border. At the moment, the notification is done in a very relaxing manner. So everyone using the system can send an alert to everyone else. So as I mentioned at the beginning, there is a discussion about if we are using it at Manchester University, maybe we will set the alert to be authenticated by the university bi-weekly COVID testing regime. Yeah, so that will make the message a little bit more clearer and sort of quarantine and you know, like maybe even adding information about what type of vaccination or what type of COVID is around. I think that's all for this presentation. If there is no question, shall we move on to the digital passport? Yeah. So the digital passport, I think many people in this meeting is quite familiar of what a passport is. The only thing I would just say that, let me just trying to get Enduring Net website. Perhaps this particular implementation, I would just ask you to pay attention that it is using a vein ID, so the vein scan of the individual to store the private information. And Simon Bing is the, hang on, let me just see. Okay, Simon Bing is the commercial director from Fingo Stellar, and they have the license to this vein scan. Let me just share this screen with you. Share screen. So Simon, we thought that it might be useful to run 2 minutes video. So yeah, we can have, you can download all the slides for these sessions from Enduring Net website. And then we're going to run this video. Let me see, I got a feeling that I might have to do something. Please, can you confirm if you can hear?
Yes.
Thank you.
Furthermore, it can be used by both smartphone users and also those without any mobile device.
It's not very clear.
It's not very clear. Okay. Let me reshare. Yeah, and share. Is this any better?
Care home facility staff member Alice is
Yes,
being tested
better.
today by the care home manager, Tom. Tom, the manager, makes the actual test and records it in a simple system. Alice is asked to scan the finger, vein ID, or download the QR code app. COVID results status is then recorded and stored in Alice's wallet without revealing any personal data or location history, as this is encrypted, with the option for that information to be deleted by the individual themselves. Only the encrypted transaction between two parties is being recorded in the public distributed ledger, and the personal and COVID test data are stored only inside a secure wallet belonging to Alice. The wallets can be unlocked with finger vein pattern scan or with smartphone device consent from Alice. Alice, our staff member, then comes to the care home reception to Jacinta, the care home receptionist, and wants to enter the facility to be able to work and help patients. She can choose to scan a QR code with her phone or simply to scan her finger with the biometric Vein ID scanner. Alice scans the finger and Jacinta gets immediate results that Alice is COVID negative. Alice can now go back to work and help the facility residents. This is the most secure and least intrusive way to identify and verify a safe passage of travel for care home staff and patients between facilities that doesn't contravene any EU privacy laws. This allows us to follow the virus and shut down an outbreak much quicker, thus limiting the spread of the virus. We take back control, all within the data privacy laws. More information on digitalpassportid.com.
Okay, so Simon,
Yeah, good morning.
to talk a little bit about how we collaborate on this project and maybe talk about this exciting launch that you guys had just before COVID, when the goal is to get, you know, about how to launch the Vein ID wallet among the three Manchester University and then creating this Manchester corridor. Please take over. Yeah.
Yeah, thanks, Sahang, and good morning, everyone. So you've just seen the film there, which had was the output of an Innovate UK bid, COVID challenge bid that was successful in May, June last year. We were happy to be invited by EnduringNet to bring our Vein ID technology, which we've been developing for several years, so that you could create a scheme which is free to use for individuals to identify themselves and access services in a way that addressed any concerns around digital poverty, around people not having to use multiple devices. So that the premise of the solution is really all you need is you. So an individual identifying themselves and accessing service through a biometric. Our choice of biometric was a finger vein ID. This is the scanner here, and if you can see my camera, uses infrared lights to illuminate the interior vein pattern in the finger. We've developed that with our own scan and match software to enable a large population match. And as Sahang mentioned, we selected Manchester as our kind of launch city within the UK. And we've done a number of different things with higher education previously in Copenhagen Business School, Brunel University as sort of trials to develop the technology and test it within a user group within a city and specifically within higher education. So we just pre the COVID pandemic shutting down hospitality and higher education, we were launching in Manchester, having done trials at the Etihad Stadium and worked with businesses to provide Fingo as a way of identifying yourself and paying. So there was a perfect fit really with the university initiative and EnduringNet to introduce Fingo. We've done a number of things in the city subsequent to that. We got the attention of the Mayor Andy Burnham, who set up a working group, which is now actively looking at how we can enable better outcomes by using secure and easy to use and free to access identity. We did a subsequent Innovate UK bid in May, and we're waiting to hear the results of that. And that was with the University of Manchester Social Science Department in terms of assessing the impact of the bid, and also with Manchester Metropolitan University, who are looking at the potential for improved sustainability outcomes through reverse vending and appropriate recycling. So with the COVID piece and working with Sahang, we were addressing the kind of privacy issues surrounding providing identity, a little bit like the last presenter talking about the local contact tracer and identityless. We're very concerned that to enable people to identify themselves provides obviously potential for data to be shared in a way that the user is not comfortable with. So we worked with EnduringNet to introduce an SSI-based technology where the individual's identity was managed in a particular way, so that only the identifier, only the moment of proving your identity in a care home context, as you just saw, was when the different components of the identity came together. So that's an overview. We're developing in other markets in the world which may be of interest. We're looking at citizen-wide schemes or country-wide schemes to support food subsidy programs in countries in Northern Africa where there's a low level of financial services access and a low level of smartphone access. So we are gravitating towards use cases where a cross-population identity scheme with a simple biometric identifier that's easy for a total population to use can add most value. So that's a bit of a flavour of what we've done. We've got another working group meeting on Monday, working with the different stakeholders in Manchester to look at both healthcare and hospitality and retail solutions. Within the retail space and hospitality space, age verification is something that is a requirement and is an element of identity that is not very easy to deploy at retail. So we had Fingo approved for age verification by Manchester City Council in the summer, and we're providing a kind of unified service where a scan of your unique vein pattern proves age, enables payment, earns points, and provides other data and puts the user in control of their data. So we are combining, and this is a bit of a theme across industry, but where identity services meet other services such as payment to create kind of new hybrid types of product is a space that we're in, and we're finding huge levels of interest, and we will be launching our next iteration within Oxford Road Corridor in September with Bruntwood. We're also providing
this September, Simon.
Yeah.
Wow, this is exciting.
Yeah. So hang on. I don't know if you had any slides on the architecture.
Yes,
maybe?
I can kind of briefly mention something especially for people here. There are quite a few people here in the identity space, so sorry for boring you with this detail. Can you see my slide?
Yeah. Yeah,
okay. I got too many things coming on. So for example, there was a question just now to talk about how, for example, in the previous case with the COVID testing, and then how do we maintain the privacy? So with Ingy presentation, the track and trace, so all your travel history is only, if you are using a mobile phone, then all your travel histories are only in your phone. And then you can send alert only through your phone. So anyone can send alert using their own phone. So if we want to make the alert tighter, then we will have these students or the staff members going to the uni house or the uni place to have this bi-weekly testing. And then when you are tested some result that needing alerting someone else, then we can have an authentication. Maybe like, for example, the test center will have to punch in certain two-factor authentication before you are permitted to send out the alert. Yeah, so that is one way of controlling the alert. So I guess the key point about a lot of these kind of privacy preserving is about this triangular relationship. So the owner of the identity, which is the red circle. So in this case will be the students or the staff members is concerned. And then the issuer, so in our example here will be the uni place, the NHS, University Manchester NHS test center. So they will be certifying what is your test result. And then the verifier in this case, in this track and trace in situation is not even a person, it's a server. The server is going to manage the alert. So in some other situation, like what Simon was mentioning, so you could be imagine that this owner is a lot of, raver going to the clubs or going to the concert, pop concert, and then the issuer in this case already is a finger with a vein with some other information able to certify that you are over 18. And then the verifier will be the bouncer, at the front door, checking and making sure that you are of the age limit to enter. So in fact, this is one of these examples in thinking about all these young people, young students, in this Manchester corridor, how the kind of city life in Manchester, so to speak. Now, I just want to mention one thing at the moment, the COVID passport is to some extent almost a dead end. I'll try not to over the time. So as we speak, Michael Gove, the MP, is chairing a review about the ethics and the kind of privacy concern about using the digital passport. So whether it is SSI or not SSI, whether it is a digital passport or whether it's a paper version of the test result. So basically the summary, the conclusion is that the public is against it. Okay, it's against this kind of COVID test result control access to the workplace or to some football clubs, football matches. It's nothing to do with the technology here. It's about it's all about, at the moment, the public opinion is tilted towards against discrimination just because there are some populations that will not be able to get vaccinated, including some disabled people, pregnant women, and also the BAME community, and some people with certain medical conditions. So until the discrimination issue being discussed, I think it's very unlikely in Britain that a COVID passport will be used or COVID certificate will be used to restrict any access. That's all. So at the moment, the COVID, but however, in our case, what I'm trying to say is we are not using, if you're using it at Manchester University, we are not using the COVID passport to restrict access. In fact, we are using the COVID passport in a very secret manner. We are only using the COVID passport to allow the person to send out a secret message to everyone else that there's someone been infected and someone has been to lecture, 2.7 yesterday, something like that. So we have not violated any privacy and we have not discriminated anyone, but we allow this information to propagate and try to keep the campus safe. I think we are towards the end. I hope I have answered your question, Nikki. This is 10:50, and then there is another session is 11 o'clock. From 11 o'clock are the special training for the young entrepreneurs at the Masood Entrepreneurship Center. But at the moment, if you do not have any further questions, we will have a 10 minutes break. Let me just have a quick look at the chat, just in case. Has anyone else got any question in case? Yeah. Chat. Let me have a look. Yeah, okay, fine. I think there is no question that I have not yet answered. Yeah, so thank you very much. We're going to have a 10 minutes break. Thank you. Thank you, Simon.
Thank you very much.
Thank
Bye.
you.